Good evening, everyone. I'd like to start with a short video that was my favorite growing up. So, potato chips. You gotta love them. Although that's not what I'm here to talk about today. Although they're truly delicious. So, this was my favorite TV show growing up, as I said. It shows how products are made. The end-to-end process from the potato to the chip to the store. It's basically a streamline of integrations. Each system's output is the next system's input. If these systems weren't fully integrated, we wouldn't have potato chips, and that would just be sad. So I really loved understanding how things worked when I was small, and until this day, I not only love understanding how they work, but I also love making them work. This is why I'm super passionate about integrations. Luckily for me, I landed in healthcare around 3.5 years ago, where integrations are a big part and challenge of our work. I work at Healthyio. What we do is turn the medical device, the smartphone camera, into a medical device. Our aim is to get patients out of the lab and into the comfort of their home. In order to do that, we need to make sure that the results are streamlined directly into the health records. So a big part of our product is integrating with healthcare. As we all know, in the past 1.5 years with COVID and everything, it's very, very important to make healthcare accessible to each and every one of us. So I've been at Healthy for 3.5 years. Today I'm a tech lead for our leading commercial product, urine tests at home. Let's look at a few of our partners. So as you can see here, we have a few partners. One of them are Maccabi and Clalit. Pregnant women all around Israel get our kits delivered to their home and do the test. And then the results are transmitted directly into their health records, where the nurse can see the results live and give the patients further guidance. If the results aren't transmitted live, our product is kind of useless, because the patient would just have to go down to the clinic and show the results to the nurse itself. So most of our products are B2B, business to business. However, in the UK, our goal is B2G, business to government. You can see the NHS logo here, the National Health System in the UK. Around a year ago, we landed a very big project with them, which was a huge milestone for our company. And one of its biggest enablers was our mesh integration that we did directly with the NHS. Integrations in healthcare are super challenging. There are a few reasons for that. We'll start with no documentation. When you're starting a new integration, the first thing you want to do is open up the docs and look at the APIs that are available. Sadly, in healthcare, that's not really an option. I'll share a short example. 2 years ago, we started integrating with one of our Israeli partners. We didn't have any kickoff or anything. We just got an email to our mailbox with a text attachment. This was the attachment. What's going on here? This is exactly what we thought. So if you look closely, you can see a patient name and some weight and height. You can make something of it, but it's really hard to understand how to compose something like this. This is why our first instinct was, okay, let's call the person up and ask them what's going on here. Let's ask our technical contacts. This leads me to our second challenge. Sadly, in healthcare, there's usually no one on the other side to talk to. I'm sure you've all tried to contact the governmental institutes in the past, Bituach Leumi, etc. They never answer. They never answer, not even after a week. When you're working on an integration, you need a response now. You need to be working on it and getting responses streamlined. So luckily for us, in the Israeli partner example, we used the geographics to our advantage, and we just went down to the Tel Aviv headquarters, sat with the developers, cracked in until the middle of the night, literally the middle of the night, and we made everything work, our code, their code, and it was a big success. Later on, when we talk about solutions, we'll see that doing the footwork is one of the most powerful tools that is the most efficient. The last thing is outdated tech. As you can all imagine, governmental institutes have old systems that are unmaintained and run old code. This leads to very complicated formats of data that we need to transfer from our servers to theirs. Just as we saw in the last example of our Israeli partners, it was kind of hard. I'll share another short example. This is a mesh message, the same mesh that we talked about regarding the NHS. So again, it's a bunch of letters and digits, very hard to make anything of it. If we look closely, we can see a patient name, we can see some urine results, but it's still hard to understand how to compose it. So when it comes to integrations, we don't have a user manual. I think the best way to learn about how to accomplish an integration is through real-life examples. So don't say I didn't warn you. This is all based on true events. I'd like us to walk through a case study of our mesh integration. This integration was very important to us, and it was very time-consuming. It took us over a year and a half to achieve a working integration end-to-end, and that's what we're going to talk about now. So what is mesh? Well, the first thing that came to my mind is this TV series from the late 80s. My parents used to watch it every evening. And although it's about a field hospital, which is to do with healthcare, it's definitely not this. So what is mesh? Mesh is a messaging protocol. It was written directly by the NHS themselves. And obviously, if you want to be integrated with the government, you better speak their language. Mesh has a mailbox approach. Each entity in the system has a mailbox. The mailbox has a client that is in charge of receiving and sending the messages, and the mesh server serves as the mailman and routes the messages between the different clinics, or in our case, our mailbox, the Healthy mailbox. Let's start going through our tools and build together an integration toolbox that at the end of our talk you can take with you home today, and next time you're standing in front of one of these deadly integrations, you can just pop it out and start cracking. So where do we start? Authentication. The first thing you need is an authentication key, something that will give you the access into the system. Usually in modern integrations, you just register, you get an API key, and you can start probing. In healthcare, it's a bit more complicated. As you can all imagine, healthcare systems are barricaded systems that you can't reach. This makes sense because you don't want anybody to be able to access your healthcare information and alter it. It's very sensitive data. So in the case of mesh, we actually need to get a license and register, and it was kind of a long process. The next thing you want is a test environment. You need a playground to start probing the API, sending requests, and seeing what the response is. In modern integrations, you usually do have a sandbox in order to probe the API. But again, in healthcare, that's usually not the case, and we usually have to test on production, which is another challenge. So we had everything set up. We got our mesh license. We got test patients, we got our client up and running with the messages, sending and receiving, and we could start composing messages. We literally composed tens, if not hundreds, of different messages and tried to get them into the mesh clinic. We couldn't. Nothing was reaching its destination. It was very disappointing, and we were stressed, like, what are we going to do? We have to make this integration work. And also, everybody else has done it, so why can't we? Giving up was not an option. So our next step was doing the footwork. We booked a flight to the UK, me and my boss, and we landed there with a cake. We spent the next few days running around the whole of the UK, trying to find a friendly face in one of the mesh clinics that would help us get into mesh and understand what format we needed to compose. Needless to say, our UK team cashed in all of their favors from the last decade or even more to get us to these people and get us the connection that we need in order to crack in. One of our most fruitful visits, literally fruitful, was to this doctor's clinic in the south of England. We actually ended up going there a couple of times. And around the third time that we got there with a key lime pie in our hands. This was because Linda, the office manager, was really keen on key lime pie, and it was obvious that we would have to bribe her somewhere in order for her to keep on opening the door for us. Another very efficient visit was with Stuart, the IT guy. So we were down in Sussex, we were talking to some doctors, and they couldn't really help us out. At the corner of my eye, I spotted Stuart, the IT guy. We all know that making friends with the IT guy is the first thing you want to do. That's always the best thing to do. So I excused myself politely from the meeting. I creeped up to Stuart. I sweet-talked him to make him like my friend. And I even achieved at the end of this session his private email where I could keep on nudging him from Israel to ask him questions about mesh. It was super helpful. Me and Stuart basically stood in front of a black console and looked at other mesh messages. I asked Stuart, how do other partners do it? Show me how they do it, and then we can reverse engineer and compose our own message to make it go into the system. This was very, very, very helpful, and we were really nearly there. So it was time to go back to Israel. And putting aside integrations for a moment, one of my biggest challenges now was hacking my way back into the house. I left behind in Israel 3 tiny children, and a quite upset partner, and I was just hoping that she didn't change the locks and I could get back home. Well, I got back home, so don't worry, and now we can continue. So we were nearly there, and this was perfect timing to stop and see if maybe there's a better way in. We were so obsessed with getting in that we took the long way in, and we actually realized that there is a direct API from our app to the mesh server that can help us send and receive messages, meaning the client that we set up we didn't really need. And this actually saved us a few weeks in implementation, because we all know that clients are hard to maintain and require more effort. So we were in. Everybody was over the moon. The unachievable was achieved. We were popping open the champagne. The Israeli team was having a party. The UK team was having a party. It was like, okay, time to go to the beach. Nothing more to do here. But we all know there's always a but. Around a month into our working integration, we found out that we had around 80 messages, that means 80 patients' results, that were not received by the clinic. The bad thing was that we were totally blind to the situation and we didn't know that it was happening. The clinic actually called us up and were like, where are the results? We were kind of speechless. So, turns out the mesh system has an ACK system. When you send a message into the mesh server, you get an ACK back saying it got there, and when it gets to the clinic, you also get back a second ACK, 2 ACKs. Now, of course, we knew about these ACKs when we were developing the integration, but we were busy getting in, and we were super psyched about just getting in, and we said, okay, we'll leave the ACKs for later, we'll handle them later. Once we were in and we were able to get back a 200 OK response from the mesh server, we were so pleased. And we're like, okay, it's fine. We'll take care of that later. So no, that was a mistake. We spent the next 2 months trying to understand what was the best way to collect the messages in a reliable way and store them to make sure that we close the loop and that each message got to the clinic and we know that it got to the clinic. You can rest assured, it's 9 months later and we have served over 20,000 patients that have received the results directly to the clinic through the mesh system. So we're up and running and good to go. Let's spend a moment to recap all of the tools that we spoke about today. So we started with authentication and test environment. You need to set up an environment that can help you probe the API and try and understand how to start closing the loop. When you're stuck, going to see the people and doing the footwork is very effective. Turns out integrations are not only integrations between machines, but also integrations between people. The next step is reverse engineering. How does everybody else do it? Always try and peek aside and see if other people know how to do it. And then, when you're nearly done, it's time to look back and see if maybe there's a better, more efficient way in. Last but not least, always make sure you close the loop. Thank you, everyone.